All right. So we'll get started. So good afternoon, everyone. I am Arun Karthik, Director for Sports at GITAM University. At the outset, I would like to thank all of you for joining us for a very special webinar, which has been put together as part of GITAM's Yoga Day celebrations. As you are aware, we have a series of lectures, workshops, and webinars lined up leading to the 8th International Day of Yoga, which falls on the 21st of this month. In addition to the regular yoga classes that we are organizing at Visakhapatnam, we are also bringing to you various dimensions of yoga to promote and encourage this ancient form of physical, mental, and spiritual practice which originated in our very own country. And today we have amongst us a highly accomplished and a very eminent person in the field of yoga. He is here to talk to us about yoga therapy and also to inspire us with his words and ideas. It is my pleasure to introduce our speaker for the day, Dr. Ananda Balayogi Bhavanani. Yogacharya Dr. Ananda Balayogi Bhavanani is a very versatile person with accomplishments in so many different fields. He is currently the director of the Center for Yoga Therapy Education and Research and professor of yoga therapy at the Sri Balaji Vidyapeeth University in Pondicherry. He is the son and successor of the internationally acclaimed yoga team of Yoga Maharishi Dr. Swami Gitananda Giri Guru Maharaj and Yogacharini Kalaimamani Ammaji Srimati Meenakshi Devi Bhavanani. Dr. Bhavanani has completed his MBBS and is also a gold medalist in medical studies. He also has postgraduate diplomas in family health as well as in yoga. He has a diploma and advanced diploma in yoga. He also has formally studied psychological counseling as well as stress management. He went on to complete his MD in alternative medicine as well. A fellow of the Indian Academy of Yoga. He has a very impressive H index of 27 and an I-10 index of 54. In addition to all of this, he's also a classical Indian vocalist, a percussionist, a music composer, and also a choreographer of Indian classical dance. With this introduction, and on behalf of GITAM University, I would like to extend a very, very warm welcome to Dr. Ananda Balayogi Bhavanani. Please take it away, sir. The floor is all yours.
Namaste, Swagatam, Vanakkam, Shubdinam. A very beautiful afternoon here with all of you, and it's an honor to be part of this Yoga Day celebrations that are going on at the GITAM University. And in fact, I came to know about the university recently through the fact that one of my senior colleagues, Professor Geetanjali Padmanabhan, originally from JIPMA, is now serving GITAM. So it's nice that, you know, we have this connection happening today, a connection that is across the ether waves, the Akash waves. And the other connection, of course, is Visakhapatnam is very close to me because my wife's brother lives there. So we visited there, and a very nice memory of the beautiful city and all the holy places around there. I will begin by invoking the Guru Parampara, because the yoga tradition is a tradition that is based on Guru Shishya Parampara, which is the connection between the teacher and the taught, a very sacred relationship that is unique and something that is still living in our Indian culture. Oh. Yogena chittasya padena vacham malam sharirasya cha vaidyakena yopakarotam prabharam muninam padanjalim pranjaliranatosmi om tatparam bharyaya vidmahi jnanalingeshwaraya dhimahi tanno guruh Prachodayate Om. Om Yoga Maharishi Dr. Swami Gitananda Giri Guru Maharaj Ki Jai. Om Puduvai Kalaimamani Puduvai Shakti Yogacharya Ammaji, Meenakshi Devi Bhavanani, Guru Mata Ki Jai. Om Shri Gurubhyo Namaha. Hari Om. The topic that I am addressing today is a topic very close to my heart because I was born into yoga now 50 years ago, and my parents conceived me in yoga. My mother was practicing yoga actively throughout the pregnancy, and even the day of my birth, she had done her morning yoga sadhana before she went in to give birth to me. Being brought up in the Gurukula of Anandashram at Pondicherry, I imbibed the art and science of yoga right from day one, learning about it in the cultural ethos of Sri Kambleswami Madam, where I was given the opportunity to learn yoga in its traditional manner, along with the South Indian music, the South Indian Natya, the Mridangam, and all the cultural ethos that comes with being in the southern part of our beloved country, Bharat. Later on, I went on to do my medical training at Nagpur and saw another part of India, and then traveling the world over the past few decades and realizing that we are sitting in a living museum. Our country is a living museum, which is so traditional, so ancient. All the ancient teachings are there and they are alive. Everything is alive, but everything is ancient. And over the years, taken up the practice and the sharing of Yoga Chikitsa. Yoga Chikitsa, which today we call as yoga therapy. So when we talk about Yoga Chikitsa, we are talking about a therapeutic application, a usage of the principles and practices of yoga as required for the attainment of wellness. This is something called Seletogenesis. And at our deemed to be university in Pondicherry, Sri Balaji Vidyapeeth, where I'm currently director of the Institute of Complementary Medicine and Seletogenesis, our focus is on Seletogenesis. So wellness. How do you attain wellness? Once you attain it, how do you maintain it? And if you lose it, how do you regain it? So the attainment of wellness, the maintenance of wellness, and the regaining of wellness, all three are possible through Yoga Chikitsa or yoga therapy. When we talk about the concept of Seletogenesis, for many people, this is the first time they hear about it when we talk about it. Thanks to my mentor, my professor of medicine and former vice chancellor, Professor K.R. Seduraman sir, who gave us this term and the concept that today has spread around the world. Seletogenesis. Salutare means health. Genesis means to give birth. Salutare from Latin, Genesis from Greek. So how to give birth? What are the factors that give birth to a sense of health and wellness? That is Seletogenesis. Now, most of the time we are focusing on the lack of health, the lack of wellness and disease, which is called pathogenesis. So the normal paradigm, the paradigm of modern healthcare systems, not just in India, but worldwide, is often more focused on disease and has a pathogenic paradigm rather than a seletogenic paradigm. So here we are attempting to shift from looking at the disease to looking at health. And this is why if you look at the WHO definition of health, health as a dynamic state of well-being. Dynamic state of well-being. They don't say dynamic, I added. Well-being has to be dynamic because it will be up and down. Everything that is biological, everything that is living is up and down. Your ECG goes up and down, your EEG goes up and down, your EMG goes up and down. It doesn't matter what test you want to do in your body, it goes up and down, because life is filled with ups and downs and ups and downs and ups and downs. And if it is not going up and down, and if it is a flat line, it means you are dead. So the fact that it's going up and down means that you are alive. You are alive and kicking. So health is a dynamic sense, a dynamic state of well-being. And the World Health Organization tells us at the physical level, it says at the mental level, it says at the social level, and over the past few decades, they have started to add at the spiritual level. So health as a dynamic sense of a dynamic state of well-being, physical, mental, social, and spiritual. And you know what? This has already been given to us long, long ago in our culture. Maharishi Patanjali, who codified the Yoga Darshana and gave us the system called Ashtanga Yoga, consisting of Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhaya, Ashtau Angani. The 8 limbs, Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi. These 8 limbs, they are directly related to this concept of wellness. So what is this relationship? Yama, Niyama. Yama is all the aspects of living where you try to stop giving into lower impulses. The lower impulses, which are subhuman impulses, based on survival instinct. To survive, you have to kill. To survive, you have to thief. And in order to survive, you have to keep procreating. All of these are subhuman tendencies, which Patanjali calls vitarka. He says you have to go against them, and hence he gives us the 5 principles of the Yama, Panchayamaha, which are Ahimsa, Satya, Asteya, Brahmacharya, Aparigraha, Yamaha, the 5 Yama, which are to restrain the subhuman tendencies. And then you have the Niyama. The Niyama are the do's, what you need to do to become more human and humane. Saucha, Santosha, Tapas, Swadhyaya, Ishvara, Pranidhana. So through Yama and Niyama, Yama restraining the subhuman tendencies, Niyama developing and enhancing the human and humane qualities, what are you doing? You are inducing the domain which is called social health. So Yama, Niyama, social health. Then you come to Asana, Pranayama. Asana and Pranayama, which are the physical practices that we do. We utilize the body in different ways, putting the body in different postures in order to posture the energy and to create a capacity to change our attitude and come into a state of balance. That is what asana is. And all the asanas working on the spinal column so that the whole spine will be healthy, because if your spine is healthy, you will be healthy. The spine, which is called Brahma Danda or Meru Danda in our culture, it is given prime importance in all the asanas. Then you have the pranayama. People say pranayama is breathing technique. It's much more than that. Pranayama is the methodology through which you can enhance your experience of prana, the life force. So you are enhancing your experience of prana. You start to know what is prana. Prana starts to move through you without any block. That is pranasya ayamaha pranayama. So asana, pranayama, they are enabling us to be as healthy physically as possible. Physical well-being. So yama niyama, social well-being. Asana, pranayama, physical well-being. Then you come to the next two. Pratyahara and dharana. Pratyahara is how you withdraw yourself from the sensory input. So the senses are constantly giving us input, and for every input of the sense, we have a motor reaction. You see something, you react to it. You hear something, you react to it. Somebody touches you, you react. Somebody punches you, you react. Sensory motor reflex is constantly happening because we are caught in that sensory motor spiral. You come out of that. You withdraw out of that so that you are seeing, but you are not reacting. You are hearing, but you are not reacting. You are tasting, you are not reacting. It is a state of pratyahara. You are going beyond that capacity of the senses. The senses are normally holding you a slave. They are holding you in a net. It's called the Indriya Jala. They are caught, you are caught in that Maya Jal called Indriya Jala. You are going beyond it. You are going into a state which is Indriya Jaya. So that now you are able to look at what is happening in life and you respond to it rather than react. This enhances the mental health. And then dharana, the mind which is always running every place, you catch it and you bring it back. And so you can put it into one point focused, it's called dharana. So these two practices, pratyahara and dharana, enhancing our mental well-being. And then that fourth domain, spiritual health, spiritual well-being. How do you enhance it? Dhyana and Samadhi. When we go into that inner state of dhyana, dhyana is not just sitting quietly. Dhyana is the capacity to get totally engrossed with whatever you are contemplating. There is a state of oneness with whatever you have chosen to contemplate. And in that state of oneness, that then becomes a complete absorption in samadhi, you are losing that lower part, which is me, all that sense of ego and survival. It is lost. And you connect to your real nature, your essential nature. And you are having a relationship with the spirit. That is spiritual health. And so we see that the concept of health, even the modern concept of dynamic well-being, that is at the physical, mental, social, and spiritual levels, all those four domains are taken care when we are working on the practice of Ashtanga Yoga of Maharishi Patanjali. We then come to another aspect. You know, I talked about Seletogenesis and Pathogenesis. So Seletogenesis is looking at wellness, looking at health. It is positive dimension. Now, most of the time when we talk about health, we talk about it as arogya. Roga is disease. Arogya is the absence of disease. Now, that is a pathogenic definition of health. That you are defining health by the absence of disease. Arogya. But 2,500 years ago, Sushruta, the great surgeon, he has given us a salutogenous definition of health, which is called swast, swastya. And what is this swast? It is so beautifully described in the Sushruta Samhita. He tells us, samadosha, sama agnischa, samadhatu malakriya, prasanna atma indriyam mana, swast itya bidiyate. That there has to be a sama, there has to be a balance. This concept of sama, which is a concept of equilibrium, there has to be a balance. Health is a state of balance. And what are we balancing? The doshas, vata, pitta, kapha. Both Yoga Chikitsa and Ayurveda share the teachings of the Tridosha. The vata dosha, which is related to the wind element. Pitta dosha, which is related to the fire element and water. And then, of course, the kapha dosha, which is earth or solid with water. So this vata, pitta, kapha, the doshas, you don't want too much of vata, you don't want too much of pitta, you don't want too much of kapha or too less of vata. You want that samadosha. Then the agni, the metabolic fires of the body, the 13 fires of the body, the jata agni, which is the digestive power, the 7 dhatu agni, which go with the rasa rakta, mamsa, meda, majja and all of that. And then the Panchayamaha bhuta agni related to Prithvi, of Tejas, Vayu and Akash. So these agnis, too much of the agni is also not good for you. Too little agni is also not good for you. You want sama agni. So sama dosha, sama agnischa, sama dhatu. The sapta dhatus which are making up our constitution, that structural elements, they should be in balance. Too much of mamsa is also not good. Too much of meda is also not good. Very less of shukra is also not good. All those should be in balance. Samadhatu. And then what happens is we have all the toxins in us. all the toxins that are accumulating, junk, junk, junk. Our thoughts are junk, our food is junk, our emotions are junk, our relationships are junk. Our life has become a junkyard and you need to clean it out. Malakriya. So that is why in yoga and Ayurveda, in both of these sister sciences, we have the concept of Malashodhana Karma, cleansing and throwing out all the waste products so that there will be efficient elimination. But then he doesn't stop there. After talking about this, he says, there has to be prasanna, there has to be tranquility, there has to be clarity, there has to be placidity. At what? Atma Indriya Mana. With the self, with who you are, your Atma. With that Atma, we are all a Vishuddha-Atma. We have to have that beautiful sense of prasanna at the Atma level, at the Indriyas level. I talked about Pratyahara, Indriya level, prasanna, and the Mana. Your mind has to have that tranquility. When we have the tranquility at all the levels, prasanna, Atma, Indriya, Mana, then we have that state of swasth. So the whole goal of Yoga Chikitsa, yoga as a therapy, is to help us attain this state of swasth. If you're already there, congratulations, you have to now maintain it. So you have to maintain swasth, and if you have lost it, you have to regain it. Attain, maintain, regain wellness. This is the principle on which Yoga Chikitsa comes in. And Yoga Chikitsa is a non-pharmacological, non-drug-based therapy. You don't have to take some medicine in it. And hence, this therapy, Yoga Chikitsa, can be taken as adjuvant therapy along with all the therapies. For example, at Sri Balaji Vidyapeeth in Pondicherry, our center for the past 12 years, we are doing work of adjuvant yoga therapy with the modern medical allopathic treatment for so many conditions, be it diabetes, be it metabolic syndrome, hypertension, insomnia, be it sinusitis, be it anxiety and depression, be it, pregnancy, antenatal care. In any of the conditions, you have the modern medical management, standard medical care. Now you add the yoga therapy to it, and it can be added because it is non-pharmacological. Similarly, you can add it with Siddha, you can add it with homeopathy, you can add it with naturopathy, you can add it with Ayurveda, you can add it with any therapy you want because it is non-pharmacological. And this is one of the strengths of Yoga Chikitsa. The other thing is Yoga Chikitsa is giving us tools that we can work with our own self. So it is empowering the individual. Normally what happens, a patient goes to the hospital and the doctor has to prescribe the medicine, a nurse has to give him the medicine, someone has to give him, come and take the test, someone has to come and give the intravenous injection, somebody has to do the surgery, somebody has to take care of post-surgical care. But in Yoga Chikitsa, you are learning to do it for yourself. You are doing it for yourself. You yourself are doing it for your own self. What a beautiful concept here, empowering the individual. And the person learns the technique as applied to them. This is a big difference between Yoga Chikitsa and other therapies. So if people say, oh, what is the yoga therapy protocol for diabetes or hypertension or cancer? Though nowadays we are trying to create standardized protocol, that there's no real disease protocol because it is personalized to the individual. Each person is different. 7 billion plus people on this planet. No two people have the same fingerprints. No two people have the same iris prints. No two people have the same genetic fingerprint. So how can you have a standard protocol for everybody? It has to be individualized. And this is why today modern medicine is going into personalized medicine. Yoga Chikitsa is already a personalized medicine. It is already a personalized medicine. That is the specialty here. So you are finding out what that individual needs, and those practices that are applied to that individual are given so that that individual can move from the state of dis-ease to the state of ease. So here the whole journey for the individual is from dis-ease to ease. Dis-ease where you have lost the ease, sukham has been lost and you have gone from sukha into dukkha. You are moving from dukkha to sukha. So it is your journey, not somebody else's journey. Hence, the practices have to be personalized for that individual. Who is that individual? What do they need? And how can you personalize it for that individual? That is the whole journey here. And this is why this modern idea that there will be 5 yoga practices for diabetes, 12 practices for hypertension, it is not really what Yoga Chikitsa is about. Yoga Chikitsa may only need 2 or 3 practices for that individual. Another individual may need 13 practices. So it is not really the condition or the disease, but the individual who's having that disease. And this is a big difference between other therapies and Yoga Chikitsa. Now, what we do find is different people have similar conditions and similar practices are needed. And this is where, though you are personalizing it, you may start to give it in a small group setting. So what we find at Saita is different people may need similar practices. You can put them together so that then you have the benefit of group therapy. The power of the group is very strong in Yoga Chikitsa, because when they can work together, they can actually grow healthier together. Because when you do the practices on your own, sometimes it can be quite boring. It can be a bit, what am I doing? But then you have a few people and then it motivates you. The positive peer pressure that can be created by group therapy, not disease specific, but individuals and the practices they need. So after this, what I would like to share is, when we come to Yoga Chikitsa, most of the time people are thinking about asana. So they say, what asana to do? Very few people realize that there are also the breathing practices, the pranayama practices that are often more important in Chikitsa. More important than the asana may be the pranayama in Chikitsa, but even more important than both of these may be the relaxation. And the relaxation practices that are there in yoga. Yoga has immense amount of relaxation practices. And these relaxation practices, which relax the body, the mind, the emotions, and help you attain a sense of spiritual oneness, these relaxation practices are the most important component of the therapy protocol. So more than the asana and the pranayama, often the relaxation is more important. And why is relaxation important? You can only heal when you are relaxed. When you are stressed, you cannot heal. So when you are stressed, you cannot heal. So it is very important that you learn to relax. When we relax, we let down the barriers of resistance. Our blood vessels can dilate. Our lungs can open up. Our heart can relax its pumping. Our mind can start to settle. The muscles can start to come back to a healthy tone. And in that process of relaxation, all the healing mechanisms will come in. Normally, what is happening? Everybody has a lot of stress. So the stress response is at the peak. The adrenaline is running so much. The person is so tight. The heart is beating fast. The person's, blood pressure is high. The blood sugar is high. The muscles are tight. You're not going to heal when that is happening. And that is why when we have stress, we are not going to heal. We only harm ourselves. But the opposite of the stress response is the relaxation response. You learn to relax. As you learn to relax, what happens? You start to heal. You facilitate healing when you start relaxing. So stress response and the healing response are inversely proportionate. The more stressed you are, the less you heal. And the less stressed you are, the more you heal. And relaxation response is directly proportionate to healing response. So through the Yoga Chikitsa, what are we trying to do? We are trying to help the person relax. Relax the body, relax the mind, relax the emotions. Get control over your own self. Start to realize who you are. Create a relationship with yourself, a healthy relationship with your own self. Most of the time, people have a very, very negative relationship with themselves. You need to develop a healthy relationship with yourself, where you start to actually love yourself. You accept yourself. And with acceptance, you can then make the change. And this is why Yoga Chikitsa works on 5 principles of lifestyle. Today, the major issue we have is lifestyle disorders. They are the non-communicable diseases. The lifestyle, 5 lifestyle starts with Achar. Achar means how are you living? What is your day-to-day pattern of living? What time do you get up? What time do you sleep? What time do you eat? What type of activities are you doing throughout your day? That is the Achar. Along with this physical external component, what is happening inside you? Vichar. What is happening inside you? How can you analyze your thought patterns? What type of vichar is there? So what type of achar? What type of vichar? What type of thought patterns? Are the thought patterns constantly being negative, 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 negative? The more you feed yourself negativity, the more sick you are going to become. And that is why we need to counter that. So hence, in Yoga Chikitsa, we look at achar, vichar. Then what do you eat? What type of food do you eat? Because what you eat, you become. What you put into yourself is assimilated, and then you create the new you out of what you eat. So you eat junk, the new you is going to be junk. You eat healthy food, nourishing food, life-sustaining food, you're going to have those qualities. So what type of food? Ahar. And then what type of relaxation, what type of recreation do you have? Do you relax in a healthy way? Most of the time, the relaxation that people are taking, the recreation they're taking is actually disease-oriented. And it becomes so lazy and so unhealthy that they are inducing disease. You want to create a positive sense of recreation and relaxation. Achar, vichar, ahar, vihar. And last but not least, as they say, vyavahar. What type of relationships do you have? So when you look at Yoga Chikitsa, it is not just what are the 3 asanas for diabetes. When you start to do that, I have coined a term about 15 years ago for it, which is now being used around the world, yogopathy. Like you have allopathy, naturopathy, homeopathy, osteopathy, yogopathy. Yogopathy is when you are looking at somebody else's diagnosis. They said the diagnosis is diabetes, and you are giving 3 asanas for it. Now you will help the person, no doubt about it. They'll be better than they are. But it is not Yoga Chikitsa. It is not the application of yoga as a wholesome, whole person approach to therapy. It is a piecemeal, fragmented, reductionist approach. Hence, we call it yogopathy. So yogopathy is looking at the small picture. It is looking at somebody else's diagnosis. It is trying to just, find a few practices you can give. Yoga Chikitsa wants to understand who the person is. What is that human being who is seeking your care? They are coming to you. They are a care seeker. You are to be a caregiver. So as a caregiver, you have to care about them, first of all. Then only you can give care. You have to understand the care seeker. So that care seeker, the person who is coming to you, what is their wholesome nature you want to understand? And for this, we have a 12-point diagnostic system in Yoga Chikitsa, where we look at what is the dosha, vata, pitta, kapha. We look at what is the guna. So that individual, are they very tamasic, very inert and lazy? Are they very rajasic, dynamic, passionate, and activity oriented, or are they sattvic in a very balanced way? So the dosha and the guna are very important. We try to understand what is the prana flow, because within the human body, there are many pranas that are flowing. In the heart center, the prana vayu called prana. In the anal region, the excretion is being done by apana vayu. So prana vayu at the heart, apana vayu at the excretory region, samana vayu at the digestive, udana at the throat that is enabling communication, and dhyana that is going throughout the body. So you want to know which of these energies is working properly or not working properly in the person who's coming to you. So we try to analyze the prana. We try to understand what is happening in the nadis. We try to understand what is happening in the chakra. We try to understand the thinking pattern. What is the chetana? What is the lifestyle? Jiva karma. And then jiva vritti. What are the biorhythms? When do they go to sleep? When do they get up? At what time do they have a bath? At what time do they go to the toilet? What are the biorhythms, the jiva vrittis? We want to understand what is the sankalpa, what are their aspirations. And you want to know, do they have viparita buddhi, any destructive habits that are preventing them from being healthy? So a 12-point Dwadasha Roga Lakshana Anukrama was divided by my father Swami Gitananda Giri. You can see him in the image behind me along with Ammaji, my beloved mother. Both my parents have been my gurus. He devised this system, Dwadasha, 12, Roga Lakshana. So finding the attributes of the disease, Anukrama methodology. And when you apply this, you are now creating a yogic assessment, a Yoga Chikitsa based assessment of the health status of that individual. And you will come up with a yogic diagnosis. So you will understand that person who has come to you. It doesn't matter if they have diabetes, hypertension. That is a secondary diagnosis from the Yoga Chikitsa point of view. What we need to know is, what are the prana vayus that are not working? What are the chakras that are having blockages? What type of patterns or behavior has to be changed? What type of ritucharya, what type of dinacharya has to be brought into that individual? All of this will determine your Yoga Chikitsa protocol. So if somebody is having a problem with the pranavayu, you have to give the practices to enhance the functioning of pranavayu. Or if it is apanavayu, for example, somebody is having issues with menstruation. It is an apanavayu imbalance. They may be having sexual issues. It is an apanavayu imbalance. They may be having circulatory issues, peripheral neuropathies, Dhyana-vayu imbalance. When they are having a digestive issue, Samana-vayu imbalance, Manipuraka is blocked. You get a yogic assessment tool, and then you take the yoga practices. What asana pranayama can be used? What type of malashodhana karma can be used? What type of dinacharya, ritucharya can be brought in? All of this is brought in. And when you start doing that, you start to look at the whole person, Purna Swarupa of that Jiva. We want to understand the Purna Swarupa of that Jiva and give the Yoga Chikitsa protocol. This is very different than the normal approach. The normal approach today is, what are the 5 practices for diabetes? Give me a standardized protocol. There are no standardized human beings. There's no standardized human beings. We are all unique, individual manifestations of the divine. And how can you have standardized protocol? So when we do research, it is very difficult, because in research, it is very difficult. Arun Karthik was mentioning about my H index and all. When we do the research and publish, they want standardized protocol. So you have to play the game. When you are playing football, you play by the rules of football. When you play cricket, you play by the rules of cricket. So when you are doing yoga research in a modern medical framework, you have to play by the rules. But do not lose track of what you are actually doing as a Yoga Chikitsak. A Yoga Chikitsak who is providing Yoga Chikitsa to that sadhaka who is coming to you, you have to give what are the beautiful aspects that will enhance. It is said in Hatha Pradipika, there are sadhaka tattvas and badhaka tattvas. You have to understand what are the facilitating factors and what are the negating factors, and you have to remove the hindrances and strengthen those positive factors. This is how a protocol is made. So to train people in this, everybody wants to have a 1 month training program. 1 month training program and you will give Yoga Chikitsa. Very difficult. I'm sorry, it's very difficult. It takes many, many years because one has to understand. In order to understand the individual's dosha, it takes many years. To understand the guna, it will take many years. To understand the nadi, it will take many years. And it comes with experience, slowly and steadily. But what is the most important aspect of Yoga Chikitsa is our own sadhana. Our own sadhana is most important. Because in Yoga Chikitsa, if you have not done the sadhana, you can never give it properly to anybody. Now, in modern medicine, you can prescribe a drug that you haven't taken. I can prescribe a drug which I haven't taken. Okay. But in Yoga Chikitsa, it's not like that. You have to have practiced it. That is why for the Yoga Chikitsa, for the yoga therapist, it is essential their own yoga sadhana. Are they living Yama Niyama? Is asana and pranayama, all this become part of their life? Then you will be a proper Yoga Chikitsa. So here it is not about saying, okay, this is easy and you learn it. It's much easier to teach people, these are the 25 asanas to be done when you have hypertension. This is the standardized protocol for depression and anxiety. It's easier to do that because anybody can do it and you just read the list. Some time back, I had a person apply to do PhD with us. We have a PhD program in yoga therapy. And we have now about 15 candidates doing PhD in yoga therapy with us. We had a candidate come to us and that person said, I have done BSc yoga therapy. I have done MSc yoga therapy. I was very happy. This is wonderful. So I said, wonderful. How many patients have you interacted with? She said, no patient. In the place where she had done her BSc and MSc yoga therapy, they had taught them in diabetes, these are the 15 asana. In hypertension, these are the 12 asana. All this they learned. They didn't apply it to a single patient in BSc and MSc yoga therapy. If you haven't applied it on another human being, then how can you be a Yoga Chikitsa? You have to apply it on yourself. You have to apply it on others and you have to understand because every human being is different. I'll give you an example. I was working in JIPMA for many years. And we had a patient. He had hypertension. So we found that, okay, his stress levels are high. You want to reduce the stress. To reduce the stress, the best thing is left nostril breathing. Chandra Nadi Pranayama. So it is left nostril breathing. Right nostril is Surya Nadi. Left nostril is Chandra Nadi. So what happened is, normally we give Chandra Nadi Pranayama because Chandra Nadi Pranayama, if I close my right nostril and breathe through my left, this is now Chandra Nadi Pranayama. Some people call it Chandra Anuloma. Some people just call it Chandra Pranayama. It's all the same. When I do this Chandra Nadi Pranayama, my parasympathetic nervous system, vagal tone will come into play and my sympathetic anxiety stress will come down. So left nostril breathing reduces anxiety, enhances relaxation. And so normally what we do is that for the people who have hypertension, left nostril breathing is a good practice. Anybody who's stressed, not just hypertensives, anybody who has stress, anybody who cannot sleep, anybody who's very tense, and too much of sympathetic overactivity is there. Adrenaline is there all the time. Fear is there. Bhaya is there all the time. So you give left nostril. So for this person, we gave left nostril breathing, taught him how to do. Now he came back after a month or 6 weeks review. And I said, how are you? We checked his BP. BP was nice, very nice. So I'm very happy. As therapist, my therapy is working. So I was very happy. And I said, how are you? He said, I'm feeling very good. Blood pressure was good. He said, I'm doing everything. He said, but doctor, I have to admit something to you. I said, what is it? See, the moment somebody says, but doctor, I have to admit, you have to be careful. It means something is, some golmaal is going on. He said, doctor, I was trying the left nostril. He said, I was not comfortable. So I started doing right nostril breathing. This is what happens in day-to-day clinical practice. Okay, theoretically, people will tell you many things. Day-to-day clinical practice, this is what happens. He said, doctor, I was trying left nostril. I was not feeling comfortable. I started doing right nostril breathing. Immediately, I'm like, oh my God, my alarm bells are all going cling, clang, boom, clang. Huh? All that is happening. I'm like, what to do? Because Surya Nadi Pranayama is sympathetic. So it should increase your blood pressure and heart rate. So always people for last 30, 50 years, they have been saying in hypertensive, don't do right nostril breathing. It is contraindicated. This is the common knowledge. But this patient is coming back for 1 month or 6 weeks. He's been doing right nostril breathing and his blood pressure is now good. Imagine. See, that is where your practice teaches you a lot. Now, if my ego is to them, no, you have to do left nostril breathing, even if you kill yourself. No, you have to understand that individual was different. Something in his nervous system was differently wired. So he was benefiting from doing right nostril, doing left nostril, he was not comfortable. So something in his nervous system. So then we got the idea. So what did we do? The next research work we did, we took 15, 20 hypertensive people. We did right nostril breathing and checked, and the blood pressure doesn't go up in them. So what we found, normally you think you do right nostril, blood pressure goes up. Yes, in normal volunteer. But in the hypertensive patient, when they did the right nostril breathing, it didn't go up because the yoga technique has its own intelligence. Now, when I sent this paper, the reviewers were very upset. What you are telling, yoga therapy technique has intelligence. Yes, that yoga technique, it is also living. Yoga technique is living. That pranayama you are doing is living. It has its own intelligence. So when you are doing, it is understanding what is your base level, and accordingly, it is modifying its effect. So if your blood pressure is normal or lower, it rises it. But if your blood pressure is already high, it doesn't rise it. It keeps it about the same or slightly lower. It doesn't bring it down for everyone, but we then published a paper, right nostril breathing may be safe in hypertension. See, this is how the practice grows, and you realize this whole idea, there will be one protocol, everybody will follow. It doesn't work in Yoga Chikitsa. Yoga Chikitsa has to be personalized. This I wanted to share very much with you because Yoga Chikitsa, and nowadays again and again, I'm more and more using the term Yoga Chikitsa. We have used the term yoga therapy a lot, but yoga therapy doesn't have the same resonance that Yoga Chikitsa has. See, there's a very beautiful movie which came out many decades ago, Shankarabaranam from Andhra Pradesh. Now that Shankarabaranam, the term Shankarabaranam has lot of cultural connotation. Shankarabaranamo Padani Shankarabaranamo Dapa Dama Mappa Dapa Mappa Dapa. See, that Shankarabaranam has a feel to it. Now, if I translate Shankara Shiva, Abharanam, jewel, ornament of Shiva, it doesn't have that same feel. You'll say it is translation. No. When we use the actual terminology, when you say posture, it doesn't have the same impact as asana. When you say breathing technique, it doesn't have the same impact as pranayama. And this is why it is not nationalism or no, it is common sense. We have to use the terminology in Yoga Chikitsa. And this is why more and more nowadays, I am being very careful that we should use the term Yoga Chikitsa. We should use the term asana, pranayama. We can translate it. Yoga Chikitsa, the application of yoga as a therapy. Asana, it is the body postures enabling a sense of stability and ease. Like that we can translate, but we shouldn't try to put one English word for the Samskrita because the terms are so strong. Yoga Chikitsa implies whole person, Purna Swarupa approach. You want to know the Purna Swarupa of the individual. What is happening to them at the Annamaya Kosha, physical body? What is happening at the Pranamaya Kosha, the emotional life energy body? What is happening at the Manomaya Kosha, all the psychological existence? What is happening in the Vijnanamaya, where the Viveka and Vairagya are there? Viveka Buddhi, three Shaktis, Icha Shakti, Kriya Shakti, Jnana Shakti, Vijnanamaya Kosha. And then Anandamaya Kosha, where we understand how we are all connected. We have to understand this. Then only it becomes Yoga Chikitsa. And that is why today my goal was to share with you this perspective of Yoga Chikitsa as a whole person, wholesome approach to health and wellness, not disease. Disease is a temporary moving away from our Sukhasthanam. Our normal state is Sukhasthanam. We have moved away. From ease, we have moved away. From Sukha, we have moved to Dukkha. What we need to do is come back to Sukha. We have to come back to Sukha. That is the most important part. And the contribution of relaxation, it is the greatest contribution of Yoga Chikitsa to modern healthcare. Because in modern medicine, as a modern medical trained doctor, I'm telling you, we don't have non-pharmacological relaxation. Somebody says, doctor, I cannot sleep, alprazolam, sleeping pill. Someone says, I have anxiety, anxiolytic drug. We don't have anything to help reduce the anxiety. We don't have anything to help the person relax. But in yoga, something very simple formula, 6 breaths per minute. This is the magic formula. 6 breaths per minute is the most important magical formula. Whenever you are stressed, whenever you are feeling uneasy, take 5 minutes of your life, only 5 minutes, and start to breathe at the rate of 6 breaths per minute. 6 breaths per minute ka matlab hai 5 seconds in, 5 seconds out. That's all. So you keep it as 6 count. So the 6 count, which will go slightly faster than a second. Okay. So what we do is we breathe out, breathe in, 2, 3, 4, 5, 6, out, 2, 3, 4, 5, 6. In, 2, 3, 4, 5, 6. Out, 2, 3, 4, 5, 6. In, 2, 3, 4, 5, 6. Out, 2, 3, 4, 5, 6. And immediately what happens? All your body systems are coming into harmony. It is called Mayer rhythm. There's a German scientist, he found that this 6 per minute is the formula of healthy cardiac autonomic function. And the moment you breathe at the rate 6 per minute, all your autonomic functions are coming into a beautiful sense of wellness. So these are some very, very simple things which we work with people. People say, oh, but you have to be fit for yoga. No, we have gone and done Yoga Chikitsa in the ICU also. 2 days after open heart surgery, we can go and we can give some pranayama, simple pranayama, Sukha pranayama, which I explained to you, 6 in, 6 out. Sukha pranayama can be done in the ICU, can be done post-op. You can do it pre-op. Before the operation, if you do it, the anxiety level will be low. If your anxiety level is low, the operation will be better for you. And if your doctor's anxiety is low, it will also be good for you. That is why we are teaching all our medical students. In our university, all medical students, they get yoga. All dental students get yoga. All AHS students, all nursing, all physiotherapy, all pharmacy, all the students in our university are given yoga so that they can understand what wellness is. And then they can take it. They become a champion of yoga to take it to the patient. The patient, when the patient tells that nurse in the future, now that student is first year student, but by the time they become a nurse, there will be a patient who says, nurse, I'm not able to sleep today. Instead of saying, here's an anxiolytic, she may say, why try some deep breathing. That is what will happen. And when we do that, we will shift from the pathogenic paradigm to cellular paradigm. So this is what I wanted to share with you today. And if there are any questions, I'd be happy to address them because I love questions. I think that's always something that I really like. Yes, over to you, Arun.
Thank you so much, Dr. Bhavanani. This was a wonderful session, and you made the relevance of Yoga Chikitsa for the current day and age. I'm sure this has been in relevance for since inception, but in somewhere I think we've just lost it. And with people like you, we are bringing this back to the fore. And there's one thing which I remember, which registered very well in my mind, which is empowering individuals to take care of their own health. uh, Again, that I think that's extremely powerful and strong, and I think if people could take that up as one takeaway from this session, that itself will be a huge addition to their their everyday thing. And wonderful. So I actually have a couple of questions for you, and then we'll move on to the Q&A box and just read through a few questions as well. My question is, where do you think yoga therapy is today in your view? Do you think it is where it is supposed to be, or do you think there's a lot of growth for it, and there is a lot of there is a need for people to understand that this has so much more impact? What are your thoughts on that?
Well, I think that we are not where we should be.
Absolutely.
Definitely, we are not where we should be, because this should be the primary system. A system which is non-drug, which is cost effective, which empowers the individual. It should be the first one that people go to. And if they cannot be helped by this system, then they should go to the other system. But most of the time, people go through about 25 doctors and then finally come to the yoga. So I think, my Professor Seduraman sir used to say, he said at the entrance of the hospital, where you have a registration counter, there they should filter people and say, these people can go to yoga as the first option. That is actually where it should be. And to some extent, we are able to have it in our hospital. To some extent, it's happening, but not to the level it needs to be. And I would say that yoga as a therapy has become more well recognized abroad than in our country, because we are still caught up with this idea that yoga is exercise. Some sannyasi will do it, or you'll go in a park and do it, or on yoga day, 35,000 people will do it. We are stuck with that. We haven't understood the health enhancing value of Yoga Chikitsa. So I feel that there's a lot of space to grow into. And I would say a lot of places it's happening. So I'm happy it's happening. And maybe another decade from now, I would answer your question differently and say, yes, we are where we need to be.
I hope so too. I sincerely hope so too. Just moving on to the Q&A box, I'm just going to go in the order in which these questions have appeared. So the first question is from Kolli Balakrishna, saying, he's asking, is watching movies an unhealthy relaxation?
Absolutely, yes. And I am answering it, though I also watch movies. Okay. So I'm not saying don't watch movies, but realize when you watch a movie, when you watch a television serial, you become so much part of it that all the things happening in that movie will be affecting you. So when there's a stressful situation, your blood pressure will go up because your mind doesn't understand that is a movie and not real life. So what I would say is that moderate dosage. In our culture, we always have understood moderation is important. So watch movies now and then. Be a bit more careful about what type of movies you watch, and make sure that you can keep that clarity that what's happening in the movie is not real, because otherwise your body systems will start to react as if it's happening to you. And I know many people, they watch a movie and the hypertension becomes worse, the diabetes becomes worse, because they have got so engrossed in that movie that it's affected them negatively. But then there are very good feel-good movies. Humorous movies are the best. Go and watch humor, comedy, because it will make you laugh. And the more you laugh, the more you can heal yourself. So watching comedy is much better than horror or all these rapid-fire action movies.
Thank you, Doctor. Moving on to the next question, which is from Dr. Jhansi Rani. So Jhansi Rani is our in-house yoga expert. And her question is, may I know what techniques you recommend for diagnostic purposes? Is interview method sufficient?
Well, usually interview gives you a lot. You can also have, because there are 4 components. When we are doing it, we are also sometimes palpating the individual to understand like structural deformities. So there is a methodology of sparshanam where you are actually palpating the individual as part of the therapy. So there is the darshanam where you are looking at the person. There is the prashna where you are questioning them, the interview. There is the sparshanam where you are touching appropriately. And then there's also nadi pariksha. So there are these techniques, but the 12 techniques that we have, most of them can be brought out even in the interview. So you don't have to touch every patient. Some of them you may have to touch to understand, like scoliosis. When the skeletal framework is different, you may need to understand. You may actually have to put them into some asana and see how the physical imbalances are there. So doing the asana can also become a diagnostic methodology for some people. But again, it's a multi-dimensional framework. And what I suggest is if you Google Dwadasha Roga Lakshana Anukrama. I'm just typing it here. Dwadasha Roga Lakshana Anukrama, my lecture on that, and the document created by my father and other essays by myself, you can see there, where we talk about the whole diagnostic criteria here. Yes.
I hope that answered your question, Dr. Jansi. So, I mean, there's also a request or check if you do any online courses on Yoga Chikitsa, at least to understand Yoga Chikitsa better.
Well, over the pandemic in the last 2 years, I've done a lot of online training.
Right.
And also every Saturday, I give a session on Facebook Live that is then found on my YouTube channel. And now I'm on to 100 Saturdays. So 100 Saturdays, this Saturday will be the 100th one. And I put a lot of videos, a lot of documents, because I believe in sharing is caring. So a lot of documents online. And recently I did a program with Hello My Yoga in Delhi on Yoga Chikitsa. It was the first of our series, which looked at sleep and mental health. So there are programs. So what I suggest is follow me on Facebook and follow my YouTube channel. And there are about 1,500 videos on the YouTube channel. I try my best to keep things free because I believe that everybody who's seeking should get it. Some things have to be paid for so that I can also live. But most of my things are free because I believe in sharing. Sharing is caring.
Thank you, Dr. Bhavanani. In fact, in the interest of full disclosure, I did a small research on you before we had this conversation, right? So, and I did discover that there's so much content that you've created, and every single video of yours is a gem, right? There is so much to learn from it, and thank you so much for spreading the knowledge that you have. There are very few people in the world who would do something like that.
Arun, I have been given so much by my teachers.
Right.
So when I have been given so much, it's my dharma to share with others. Because I believe that holding on to it, we limit it. It is said that when you hold, anything in your hand, you're limited by what you will get. But when you share, you open your hand, you'll always have much more. So I believe in sharing because I have been given so much. When we have been gifted, when we are fortunate, when we are blessed, we must share. Otherwise, we are performing theft. And I don't want copyright theft. I don't want intellectual property theft. The rishis have given us this. This is all the Rishi Muni's wisdom. Right. So why should we limit it?
Agreed, sir. Totally. We'll take a couple of more questions and then we'll close it. The next statement is from Prasanna Lakshmi. She says, thanks, Dr. Ananda, sir. It was quite informative and insightful. Could you please give us a few asanas? I'm guessing this is like the 6-minute pranayama practice. Will help, which we can practice on a day-to-day basis or on a daily basis.
Yeah, here what I would basically say is, again, individually based. You have to look at each individual. But if you look at practices where there is a forward bending, a backward bending, a twist to the right, a twist to the left, this is going to make sure that your spinal alignment is maintained. And if your spinal alignment is maintained, it's going to help your health. So doesn't matter what asana you do forward bending, it is based on your capacity. Some people will do Paschimottanasana, somebody may do Padahastasana, somebody may go into the Bhumasana. It depends on the ability. Forward bending, one asana. Back bending could be a simple Chakrasana, could be an Ushtrasana, could be a Bhujangasana, could be a Shalabhasana. A back bending to balance it. A twist to the right, Vakrasana, Ardha Matsyendrasana, like that, so that your spine is kept healthy. This is one formula. The next formula is one asana at least where your head is below the heart. Because when you bring your head below the heart, you are resetting all the mechanisms of your cardiovascular system. So any posture, Padahastasana will also do, Mervasana, which some people call Adho Mukha Shvana, will also do, Parvatasana, some people call it. Or if you can do the Viparita Karani, the Sarvangasana, or you are able to do the Shirsasana, well and good. Any posture where the head is below the heart, depending on your physical capacity. So as I said, front bending, back bending, twisting, one head below the heart, and Shavasana. Shavasana is the most important one because it is the asana where you give yourself 5-10 minutes and say, it is okay to relax. It is okay to relax. You don't have to always be doing something. It is an important message because we always think we have to do something, and we burn ourselves out. It is okay. It is okay to relax. So Shavasana, 5 to 10 minutes for sure. Those are the 5 asanas.
Wonderful. Thank you, Doctor. So one question on behalf of the students. In this fast world, fast-tracked world, where there is no time, where patience is very less and everybody wants immediate return on everything that they do. What is it that you would advise our students, not just for having a healthy life, but you spoke a lot about relaxation. There is so much stress nowadays, there's exam pressure, there is peer pressure, there is so much pressure from so many different angles. So if there was 1 or 2 advices that you would like to give our students, sir, I think that would be helpful.
I think the first point is that when you are caught up in the rat race, even if you win it, you are still a rat. You're not a human being.
Right.
In a dog-eat-dog world, if you are the top dog, you are still a dog, not a human being. So I think what we need to realize is each one of us is different. And we first need to stop comparing with anybody else. I think the surefire way to feel depressed and really get upset is to compare with somebody. You are not to compare with anybody. You are you. You are a unique specimen of the divinity. So then why compare? So I think the first thing is realize you are you and there's no other you on this planet. So then why compare? First point. Second is what is in your hand is to do your best. If you are a student, it is your dharma to study to the best of your capacity. If you are a teacher, it is your dharma to teach to the best of your capacity. If you are a farmer, it is your dharma to farm to the best of your capacity. Now you can only do your best. But what comes back to you is not in your hand. And that is why the message of the Bhagavad-Gita can be summarized in a simple statement. Do your best, leave the rest. So I can only do my best. I have no control about what comes back to me. So I can study, I can do my exam to the best of my ability, but what grades come is not really in my hands. The effort is in my hand. Now, if you don't make an effort, you're not going to get anything. Like if you haven't ever planted a seed, you'll never get a fruit. But if you want potatoes, plant potatoes. If you want mangoes, plant mangoes. Many people are planting potatoes and they want mangoes. It will not happen. The effort you put in, the result will come. And we need to develop patience. Wait and see, because I tell you, so often, just that one moment later, the reward comes. But because we were not having the patience, we missed that moment. It's like you have that appointment with God and God's going to come. And just 5 minutes before that, you get upset and you walk away and God comes and you are not there. We often do that. So have patience. How do you develop patience? Practice slow deep breathing. The moment you practice slow deep breathing, Your prefrontal cortex, this is the part which is most important in human being. This comes into play, and this will tell you it is okay to be slow. It is okay to be steady. It is okay to be wait. Just wait, and it will come. So the message is you have to put in the effort, but do not ever think that you are in control of what comes back. So many times in my life, there are times I've done so much and nothing came back. And there are times I did nothing and a lot came back. So the universe will balance it. The universe will always balance it. Have the trust in the universe. But it doesn't mean you say, oh, I'm going to lie back and God will do it for me. Nothing. You have to do what you need to do. Every moment, ask yourself the question, in this moment, what am I to do? And do it. Ask yourself, in this moment, what am I to do? And do it. And my father used to say, do it now. Do it now. Din, 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 do it now. What's to be done in this moment, don't push it to the next moment, because next moment you will not do it. So what you need to do it now. And whatever comes, have that smiling grace and say, thank you, God. Because when you say thank you, God will feel like giving you more. When you complain, God's like, oh, seriously, whatever I give, this person complains. Why should I give them? So whatever comes, say thank you and say, I'll make a better effort next time.
Well said, Doctor. Just the last two questions. I mean, I'm going to club them into two. They're not really related, but the first one is there a Yoga Chikitsa place in Andhra Pradesh that you know of? And secondly, how do you make children work on yoga? Firstly, is it required? Second, if so, how?
Well, coming to Andhra, I am not so update on the new, yoga therapy centers. There was the Vemana Yoga Research Center. I know that was doing a lot of therapy work, but I would not like to comment on that because I'm not too sure. But coming to children, I can really comment on that because for the last 50 years in Pondicherry, we have worked primarily with children. And both my parents worked with children. I have worked a lot with children. The key to taking yoga to children is keep it fun. It should be fun. So it should be in a very jovial manner, lot of laughing, lot of animal sounds. So you make the pose like a lion and then you make a lion sound. You crawl around like a tiger, making a growling tiger sound. You have to have a lot of noise. You have to have a lot of fun. You have to have a lot of creativity. If it is fun, the kids will love yoga. And at our institute, the kids, when they come to the yoga, they don't even want to go on holiday with the parents. The parents come and tell me, Doctor, sir, please tell my child to come with me on holiday. They don't want to miss your class next week. And then I have to tell them, it's okay, you miss one class, go and come, you can pick up. Because they love it so much. So with children, you have to make it fun. And again, children will not listen to what you say, they'll watch what you do. So as a teacher, as a yoga teacher with children, be very careful of what you are doing. Because that is what they'll follow. You will become the role model, not what you say. And if you live the yoga, the kids will love yoga.
Fantastic. So that's it, sir, from our side. I think I don't have any other questions to ask you. It was an absolute pleasure having you here and to hear those unbelievably awesome words from your mouth. It was just absolutely awesome from our side. And extremely grateful to the knowledge that was passed on to you, which is now being passed on to the rest of the world. And thank you so much. Thanks so much for taking time off your busy schedule and addressing us. On behalf of GITAM, we'd like to extend a very, very, very hearty thanks to you, sir. Thank you so much for.
Thank you so much, Arun. Thank you to all the participants for being with me today. Thanks to the university, and maybe all meet up soon wherever that is. And may Mother Yoga, our Divine Mother Yoga, always be proud of us. Namaste, Dhanyavad.
Thank you so much. Thank you.